let's then kick off. Did I forget to say anything? Peter, anything comes to your mind before we'll start with African care?
No, I think we are good. It's just keeping to the time of 15 minutes.
Yeah. And then without further ado, let's ask Noor and the team to start. So Mika will take the opening slide away, and then Noor, you can kick off with your presentation.
Yeah, okay. I'll start for the introduction. African Care has started for implementing this digitalization of the records of the registry of the clinic in Afgoye, Somalia. Before we started this session, we have discussed it also yesterday. The staff in Afgoye and their views, what they have achieved, what they have achieved. So the main task for this was to record all the clinical interactions, the records of the 4 different registers, which has been handwritten registers before, and they have been using the registers for decades, and there are a lot of data collected in that registry. And the aim of this experimentation was to build a new system, information system, that can be collected, information stored and also managed by the staff of the clinic. And the main requirements for this was to be easy to use and low cost, and even in different platforms to use in app version and the browser-based backend management. As everybody knows, the African internet system is still developing, so there has been low internet connections. That's why we have selected a system which can work offline mode. In this solution, African Care has collaborated with Fingo and Fingo Powerbank, Afgoye Clinic, of course, and the developer from Missouri Global Solutions. And there has been a lot of documents, a lot of records in previous years, but anyway, the clinic has 13 staffs who are using the system, and the records of the almost 1,200 pregnant women are going to be entered every year, and more than 2,000 outpatients are visiting the clinic, and also included the IDPs, the refugees are living in the area. So you can see the picture below is the old paper-based registry that they have to use it by hand, written everything by hand, and to collect those information to Excel for the project management and statistical purposes later in every month to collect the data from the paper register.
All right.
Now we are going to use the new system, so Mo will start how we implement it and so far.
All right. Thank you, Mr. Noor. Let me go. So we're gonna start with the part which is what is new in this experimentation. I hope everyone can hear me. So basically, we divided the main 2 sections that are new in this experiment are basically they used to have, as Mr. Noor mentioned before, they used to have existing registries, which consisted of ANC register and PNC register, label delivery register, and immunization. So basically those registries used to be done by a handwriting, a paper, or like they used to have books to register all those data. And the second one is developing of electronic medical record, which is developing a whole EMR system for them to use inside the clinic. So that was basically, to summarize it all, is the existing, to basically digitize the existing registries and then develop a system which actually replaces the paperwork and manual workflows. So we're gonna go on from there. So we're going to go into the challenge. So one of our main challenge, and actually is going to be challenge in Somalia for a while, it's poor internet connection. And so our system, it's actually a web-based system. The EMR is a web-based system. And that means actually it requires internet. So with internet, it gives you the ability to log in or to use the system from everywhere in the world. So the problem with that is when in Somalia, they have a poor connection. So they won't be able, it's going to be actually slower to use the online one. So we had challenges with that. The system will become slower. So you got so many clients, and then at the same time, like not anyone can wait for a data registry that's based on the internet. And the second challenge was the EMR uses SMS gateway to send SMS. The problem with that is the SMS gateway uses internet to send SMS. And as we first mentioned, with the poor internet connection, it's actually impossible to send an SMS because the system would actually send an automated SMS, which could be an appointment reminders or like something like that to the customers. So when the system sends an SMS, it requires an internet. So when there's no stable internet, it won't be able to send the SMS by itself. So the things that we overcame with those two challenges, number one, the poor connection with the EMR or using the system. So we came up with the solution, and that solution was to install the system locally in the local area network. So in this case, they won't require an internet to use the EMR. And it actually, of course, is going to be more faster. And then the second one, the thing that we overcome with the second challenge was we decided to get a separate platform from a local company, which is actually a telecommunication company here. So that is actually will give them the ability for them to send SMS whenever they require. But the problem with that itself, it's that SMS platform won't be integrated to the EMR system or the system that we've developed for the clinic, because it's actually a separate platform. So right now, what they would have to do is like they would have to do everything manually, but that would help them actually do everything without requiring an internet connection. So we're gonna go on. So results and success. One of our main achievements or results was right now they have an easy digitized patient registration that that actually they could save the patient's family and the patient's family relations, the patient's regions, the patient district, the patient's village, full name, all of that. Actually, you can manage all those records and you can retrieve the patient's information. For example, back in the days, before the system, if you want to look up patient information, you would have to go through actually a load of papers. So right now, it would only take them a few milliseconds to get patient records or every other information about the patient. The second one is in the inpatient management, patient lab management. We've developed a patient lab management, and then after that, that patient lab management is integrated to the EMR that we've developed. And then you got the queue management, which manages the queue for the outpatient. You get the PNC, ANC, label delivery, and immunization. Those were the existing registries that was been used by this clinic. And then, of course, the last one, which is the reporting. So those are the results and success that came out of that project. These are the interface for the EMR, as you can see on the left, on the right, I mean, this is the patient registration form. This is the information that it's being registered from the patient. As you can see, the patient name, gender, age, date of birth, house, street, village. So all those things, like back in the days, they wouldn't save those information. They would just save a few information like patient name, gender, and age. So we've added all of this because for data in the future, because this data might help us in the future. We could get, for example, in the future, how many patients we got from one specific village. The age between which age are like the most to visit the clinic, or like things like that. And on the left side, we got the dashboard. This is the dashboard. As you can see, all these are the sub-modules for the system. You got the patient registration, programs, clinical, radiology approach, inpatient, patient documents, reports, and all this. We go from that. This actually the most important part in the EMR. It's where the doctor checks after the patient submits. This is the dashboard where the doctor would know everything about the patient. So you can know the treatments for this patient, the lab results for this patient, the programs, how many times they visited, the diagnosis, this is positioned, how many lab orders, how many radiology orders they did. So basically it gives full information about the patient, which is actually a thing that they didn't have before, because if you want to know something about the patient, you would have to go through thousands of papers to know an information. So right now it's only just a few milliseconds away. So if we go from here, so the expectations from this project are basically which is and the most important one, it's providing an up-to-date and complete information about patients. As mentioned before, right now for you to access patient information or like a simple patient record, it would only take you a few milliseconds away to get or retrieve information about that patient, compared to the previous workflow that they used to do, or like previous methods. So right now, as this one connects to the first one, which is enabling quick access to patient records for more coordinated and efficient care. The third one is securing sharing electronic information with patients and other healthcare professionals. Of course, as you can imagine, any doctor, any physician that works in that specific clinic can be able to access patient records, and it won't take them that long. Actually improve patient and provider interaction. That got to do with the doctor knowing the patient's information. So you can improve a lot of things about the patient, or you can interact with them like more efficiently if you know everything, or like the previous history or the previous medical history for this patient. So it would be easier for the doctor to communicate with the patient if they know everything about, or like if they have some kind of an info or previous info about that patient. Enabling safer, more reliable prescribing. Actually, the system has part for prescription, so the doctor can prescribe medications, and if the patient comes back, the doctor would be able to actually see the medical history, or like the prescription that was given to this person. So if a doctor gives him maybe some, if there maybe happened some kind of a mistake happened in the prescription, maybe the other person would be able to see, and then would be able to manage it. So enable safer and more reliable prescribing, as I said, and then enhancing privacy and security of patient data. As of course you can guess, everyone has their own login data. So there is an administration that could just add users, give roles and permissions for the users of the EMR. Enabling providers to improve more efficiency and help people. And then the last one, which is to reduce cost. Of course, right now, if when the physician or like the doctor's orders a lab test, the lab department won't require a paper from the patient, because they will already have their own system, and then their system, the laboratory management, would be updated, and they could be able to see the order that was orders from the doctor. So instead of the patient getting a paper from the doctor and then that paper printed out for him and then goes all the way to the laboratory. Right now, they don't have to do all of that because the laboratory themselves, they are updated and they would be able to see the lab orders that was being done by the doctor. So
thanks, Mo. Excellent
introduction
here, and I think now it's time for questions, and there are already some questions. So
first.
Mika is saying, seems great. Is the solution already in place, and have you received any feedback about it? So what is the feedback from the users in the clinic? What kind of trainings they might have needed? What kind of have they had any issues there? What's the general mood there?
Yeah. To answer that, actually, before the feedback, we don't just build the whole platform and then give it to them and then just wait for feedback. So we do is like we use some kind of a software project management. So with this, what this does, like you do the planning first, you come up with a feature and say, okay, this is the PNC form, and then you design the form in the system, and then before you actually go for that, before that form goes online, we just go back to the client, and then they would actually what they do is like they would check the form and they would check all of that, and then they would give us the feedback, and then we would fix that feature, and then we would go on to the other feature. So the whole project was actually in it was feedback and then implementing that feedback and the feedback and implementing that feedback. So we started that from on the planning stage till the implementation. So all of that was between we had interaction with the African care team, our Mysore global team, and the the clinic team. So it was like back and forth communication.
Yeah, thanks. And how about if other organizations now are looking at this and saying, hey, that looks pretty good. We would like to use it as well. So Noor, Mo, how is the shareability?
I think I'm gonna let Noor answer that. Is he online?
Yeah. The system is open source and it can be modified and integrated to any clinic anywhere in the world, but it needs a lot of technical issues to be defined before you use, and it's you need a developer to use, and also the clinic staff on needs to be defined what they need from the system, so it can be adapted in any clinic.
Very good. That's good news for others. So that's something that other organizations could benefit as well. Peter, are there some points, because you have been following this experimentation from the beginning? Are there some points you would like to highlight to take away from this experiment, in your view?
Thanks, Mika. Thanks, Noel and Moe, for presentation. I think the two presenters have captured the spirit of this experimentation, which was digitization of the business process, starting with this particular clinic to add efficiency in the clinic processes and provision of better services to the citizens. So these are two key things that this experimentation was geared to achieve. Improve the process and also the service to the citizens. And that has been mentioned, for example, the reminders to the mothers when they need to come to clinic. And I think one of the things is the scalability, particularly being this is an open source, however much technical processes and things that need to be modified, the fact that it is open source gives it a big plus. Sorry, participants, this was shot by these presenters, but you can listen the whole day about this because I know the much of the work that has been done, particularly that this experimentation is not an upgrade. This is work that all started with this experimentation from point zero. So a lot has been done. in this. And one of the other interesting things, like the slide that is there, is how this experimentation has tried to use the principles for digital development in the design and in the implementation of the work that they have already done. And they have actually capitalized on the people, understanding the people and the process, and then the technology. So this experimentation started by understanding the two key things: the people or the community and their needs, the process that is existing, and then bringing in the technology that they have been experimenting. Back to you, Mika.
Yeah, thanks, Peter. Good summary there. And lastly, now before going then to FCA, there was a question from Ari Koivu. So, how many health centers are benefiting at the moment?
Should I? Right now, actually, we've started with one, as far as I know. But the thing is, our system, there are actually multiple clinics that could share at the same time. So right now, what we think, or we did, is we've installed the system in offline mode. But the thing is, the system is actually a native web app, which is actually a web application, which is a system that was designed to work online. So the thing is, whenever the internet connection, if the internet connection becomes stable in the future, it would be easier for them to actually get the whole data from offline to online, and then on that moment, actually, what could happen is multiple clinics can use that one specific system, which means you would have a huge database, a huge information, and from that specific area about any patients in there, or like and anything. So basically, right now there's only one clinic, but in the future, like it's actually an open for scalability, or it could be able to be scalable in the future.
Yeah.
Very good.
Yeah.
Excellent.
And if my add also last session in October, as I remember, we have discussed it with Until to how to be used in different rural areas in Somalia, and it can be also modified for their needs too.
So if you want to know more about this and have a further discussion, so do contact African Care, and let's see if we could also get this solution to our technology solutions portfolio or in the Powerbank pages to highlight it there as well. But now, thanks a lot for the presentation. We'll move to FCA. And then again have around 15
Should I
minutes
just stop
presentation.
the share?
Yeah, thanks. 15
Thanks.
minute presentation, and then go for the Q&A. And anytime during the presentation, feel free to post questions to the chat, and we'll use them in the Q&A.
How about now?
Yeah, now it's
Okay.
perfect.
Good.
Great.
Yes, sorry about these problems. Yep. Education is the biggest and important part of FCA work. And during this very exceptional year, and because of the COVID-19 and lockdown, it made us face big challenges in the education, and they are even harder in the refugee settlements and refugee contexts. Our Kenyan team has worked really hard to tackle these problems, and they have been working on the transition from face-to-face to distance education, and this actually this Fingo experimentation has been great boost to test new methods and technologies in this remote or distance education work. I have with me here my two colleagues from Kenya. I have education specialist Ahmed Salih from our Nairobi office, and then there is also our education officer Kevin Otieno from Turkana County offices. He has been working in the Kakuma and Galo Bay refugee settlements, and I would like them to continue with explaining the project and experimentation a little bit forward, a little bit deep. Kevin, are you there online? Would you please continue?
Thank you, Percy. I'm here online. And thank you, everyone. So like Percy has said, when the schools shut down, we were faced with the challenge of how to keep the children learning. And in the settlement, FCA manages 5 schools with a total population of over 18,000 learners. And that was really a time for us to think of what can we do very fast, something that is affordable and scalable. And the FCA team, both in Nairobi and Kakuma, consulted very fast and rolled out the radio lessons intervention. But then there was also the support that we needed to give to the teachers in terms of mentorship. But we could not do this on a face-to-face basis the way we used to do. So the team again designed a WhatsApp mentoring intervention for the teachers and rolled it out. So the main aim of what we were doing was to provide effective, feasible, and reasonable solutions for distant learning, teaching, and interactivity in emergency situations, and the subsequent support for normal school. And the radio lesson intervention also came with the need to provide life-saving messages on COVID-19 to children, parents, and teachers. You remember this time again, there was need to pass information so fast to these children as the schools were closing, so that even as they were staying in the community, they could still be able to practice safe hygiene practices. That is for the parents, the children, and all the teachers who were involved. With that quick intervention, we managed to purchase 500 radios, which we gave out to the community. And we also, in collaboration with the UNHCR, broadcasted lessons to these 18,000 learners. And then for the teachers who were mentoring other teachers, we designed a curriculum and rolled out a mobile mentoring program for them. Next slide, Percy. But in Baringo, which is another site where FCA works to restore peace and stability, FCA managed to scale up radio programs where the community leaders were able to continue to provide radio talk shows to the community and engage with them as we were doing on a face-to-face basis. But then FCA also managed to ensure that radio lessons were supported with the memory sticks and a solar charging kit. And why was this important? In the settlement, there isn't 100% electricity coverage. Actually, the electricity that is being rolled out currently has not even reached a quarter of the households. So it was important to provide a solar charging kit so that households do not have to incur extra expenses in trying to buy dry cell batteries to run the radios. But the memory sticks also helped us to give the learners pre-recorded lessons so that after the classes, if they needed to listen to the whole lesson once again, then it was a little bit convenient for them to do so. But FCA also identified that the COVID-19 prevention messages that were being aired at that time were not child-friendly. Some of these messages were talking to adults only. So FCA worked with a partner, which is called Felm, to design child-friendly messages. And we were the first to make sure that children were talking to other children in terms of how to keep themselves safe from being infected by the coronavirus. But when we were rolling out radio lessons, there was a need to keep getting feedback from the teachers and improve on what we were doing. And so the team created a network of WhatsApp groups that were designed for each school and then connected to the project team so that the project team could be able to get feedback from the teachers and work with the people at the radio stations to improve on issues that teachers were raising. Again, teachers were able to collect views from parents through these WhatsApp groups and channel to the project office for action, and that flowed on and on very smoothly. Then there was need to also support some training for the principals and head teachers, and FCA managed to do this through the Teams platform. Next slide, Percy. So you can see some of the children that we work with, and this is Teacher Seme in a typical radio class. So the radio is there, they are listening, but Teacher Seme is also supporting these learners to take notes and also answer some of the questions that they may have. Next. But this intervention was not without challenges. When we were rolling out this for the first time, there were so many questions from partners and other people who were wondering, how is this going to happen? You know, a radio set costs around 40 euros, and that is a lot of money by any standard. So people were wondering, how are you going to acquire this set and give it to the community? Does it remain the property of the organization, or does it become the property of the household that receives it? Some other people were worried about which criteria was going to be used to distribute the radio. So who are you going to give and who are you not going to give? Like I've said, a radio set costs, the type that we gave costs around $40. And if you have to give it to Kevin and not give it to Percy, then you really have to have a very clear criteria so that, again, you don't cause conflicts in the community. The other challenge was that there are so many languages in the settlement, and the radio lessons need to be translated into these languages. And the COVID-19 prevention messages needed to be translated into these languages, and sometimes that can be really costly. But again, as you've seen in the previous slide, we only had 500 radios, and the households are so many, so we could not reach all the households at the same time. In the WhatsApp mentoring for teachers, we realized that internet connectivity was a challenge sometimes, much as Kenya has a very good, a very strong communication companies. But in the settlement, very far away from the capital, sometimes we could experience instances of fluctuations. And of course, some of our teachers attended some of these trainings from the quarantine station. And of course, some were not able, one of them was not able to connect due to a SIM card problem. But we have tried to change some of these things to address some of the challenges that we face. And so we engage teachers in designing the curriculum. We have also provided an induction for the teachers, and we have provided the teachers with smartphones and bundles to enable them to continue to connect, to continue to share feedback with us, and to continue to share learning materials between themselves and their learners. Next slide, please. There are some lessons that we have learned and that are worth sharing with all of us. That over time, we have managed to improve on the targeting criteria. And you know, this has really earned us confidence from the community that people are feeling more and more that we are working more transparently. And as an organization, we also emphasize on the do no harm principle, that people are already affected and whatever we are doing should not cause more harm. And through our complaints and response mechanism, we have been able to engage with the community, receive feedback, and act on any complaint that may arise. We have also realized that the participation of parents is quite important at this stage, that parents are the first teachers that the children have at home, but also the parents are protectors. As when the schools closed and children went back to the community, FCA could not provide the safe environment that the children always had in the schools. But again, the radio lesson also meant that children from different families would come together, and it was very important that these children are under the care of a parent. So the involvement of the parents has helped us to improve on learning and the protection of children. And so far, we have not had a case where any incident has arisen that is of the nature of child abuse. Radio lessons, therefore, we hope should continue post the COVID-19 pandemic to complement normal teaching and reach out of school children, because the area where we work in also has pastoralist communities. And some of these children are out there in the field looking after animals and taking care of other issues. And some of them are not able to go to school. But if we continue to improve on the radio lessons and continue to improve on radio coverage, then even that child who is looking after the father's animals in the field will be able to carry with him a radio and be able to attend classes just like any other child in the settlement. Next slide. What are our achievements? The WhatsApp platform has enabled us to continue to share information very fast, that is with the teachers to share information between themselves, to share learning materials and any other materials that can support the work that they do. The mentors and their mentees continue to engage in continuous exchange of ideas. And you know that we have shifted from the normal school and learning routine to the remote learning. And this comes with learning new skills, and teachers need to continue to learn, and they're doing this through the WhatsApp platform. The teachers that we mentored continue to share the knowledge that they learned with other teachers and to support the learners that they work with. We have started a new cooperation with our partner FieldMed to continue to design education content and messages as things change. But whatever we have done has also earned the confidence of other partners. For example, UNSCR has invested in more radios, and as FCA, they have added 600 more radios that we are distributing to the communities right now. And FCA has also secured funds for more radios so that the radio coverage per household can be improved. And then other partners have also seen the work that we do, and they now know that this is successful, and they're learning a lot from us in terms of designing messages for children and also rolling out the learning interventions. At the end of this experiment, we hope that the mobile mentoring curriculum that was designed during this time is going to be refined and used in almost all the sites where FCA works, because that curriculum has proved to be a success. And we are going to identify and incorporate more trainings via the WhatsApp platform. We are going to incorporate radio lessons into normal teaching and learning post-COVID-19. We are going to sustain communication and engagement with community via FM radio stations. We are going to train teachers on alternative teaching methodologies so that they can continue to adapt. Next slide.
Kevin, thank you very much for the presentation so far, and I know there is much more to tell. At this point, we will take time for the questions and answers, and note that all this documentation will be shared also afterwards, so you don't lose the additional information. So Peter, would you like to pick up some questions that have been posted to the chat?
Yeah, thanks, Kevin. And Pasi, there's a question from Laura. Is the curriculum designed by FCA, or is it designed with the local community, or both?
Thank you, Peter. The curriculum is designed by FCA, but in consultation with the local community and the teachers.
Okay, thank you. Then we have a question from, sorry, Kevin, you seem like you wanted to say something else.
Sorry,
I'm actually saying, Kevin, can you go back with the slides so that we can see the photo? There was a great illustrating, yeah, this one, just to have it there.
Yeah, so we have a question from Ari Koivu. Do you have experience yet how long the radios are workable, and also about the phones donated to kids? I think this question from Ari is about how durable they are and how long they can stay, or lifetime.
Thank you, Peter. These radios are quite durable, and if you can look at the one on the photo, for example, the buttons are quite strong. So far we have not had any incident where a radio is broken, but there could be a few issues with the solar charging. So again, that is an opportunity for the young people we hope that even if these radios break down, then it should create also another channel for learning and income generation for people who can be able to repair the radios and restore a few of the components that are replaceable. On the phones that were donated to kids, these phones were actually donated to the teachers, not the children. Thank you.
Thank you. Mika, can I make a comment? We don't seem to have other questions.
Maybe Peter, sorry.
Yeah, go ahead.
This is Ahmed Shale, a colleague of Kevin. Thanks a lot. I saw a question asking about curriculum. Yes, we did not develop the curriculum. The radio lessons, we used the Kenyan curriculum. We received the pre-recordings lessons from KICD. KICD is Kenya Institute of Curriculum Development, an institute which is in charge of curriculum development in Kenya. So as FCA, we are implementing partner, or we implement education in emergency income-based settlement on behalf of United Nations. That's UNHCR and UNICEF. So with their support, we received the pre-recordings and the timetable from KICD, where the learners, we gave them the timetables, and then the learners were tuned to the lessons of that day, radio lessons, using the radios that we have given, the 5,500 radios that we have given to them. So we have been using the curriculum from KICD, but we have not developed our own curriculum. The other one also, we were in partnership with UNICEF, UNHCR, and also the other education partners that we have in the camps. That is Lutheran World Federation, that we partner with them. Apart from having the radio lessons, sometimes we used to have live talk shows. That is, we have local FMs here in the camps. So the teachers were going to the local FMs and giving the lessons, the live lessons from the FM. So we have two of them: the lessons from the FM, which is done at the local, in the context where we are, and also the pre-recordings that we received from KICD, which is the national one that we have been using. So all in all, we were in the using the content that we are to develop. We were to give to the learners during the face-to-face session. Thank you, Peter.
Thank you.
Thank you, Peter. Again, just to clarify that, yes, that was from the KIC, but the mobile mentoring curriculum for teachers was designed by FCA in consultation with the teachers and the community.
Maybe Kevin, you answer the second question. How do the memory cards work in practice, and how are they distributed?
Well, the memory cards are used to store the pre-recorded lessons. So these memory cards are also distributed alongside the radios, so that whatever the lessons that are aired at the radio station, the learners can also be able to carry them home in the memory sticks.
Okay. The radio. Sorry, Peter. One more. The radio. They use solar, and if you charge the radio once, it can restore that power for 8 hours. So you see the durability of the storage of the power. And sometimes even when the learners are using the radios, they can take the solar. It has, because that's the string, and then they can take outside, and then it can continue charging as the lessons is going on. Thank you.
Thank you, Kevin. Thank you, Ahmed, and thank you, Pasi. Just to make a final comment on this, Mika, if you allow, is that FCA, when we embarked on this experimentation, one thing is when COVID hit and in Kenya was pronounced, and in the spirit of making sure that no child is left behind, because most of the other parts of the country were able to access the national radio broadcasting, live broadcast for primary and secondary curriculum. But incidentally, this part where this camp is, Kakuma, where FC is working, they are not able to access live broadcasts like other parts of the country. And this is where the radio and the memory card come in, that they get these pre-recorded broadcasts from Nairobi, and they are put in memory cards and they are replayed in the camp, in the radios that they have talked about. And then we saw the teacher there, that some of this camp, the children may have language barrier and the speed at which the live broadcast is done. So when it is done locally in the radio and stored in the memory card, the teacher is able to replay and explain every part of broadcasts. They can stop the playing, explain every part, and then continue with the playing. So that barrier problem of live broadcasts was overcome in that way. So generally there's experimentation was to make sure that children in the camp are not left behind, because in that region of the country, there's no signal, there's no airwave for the national radio broadcasts for the curriculum as other parts of the country. Thank you very much. Back to you, Mika.
Thank you, Peter, for the summary and good questions and responses. And as Ari is saying, indeed, this sounded like a problem solved. Well done. Yes, easy to agree. Now we are in the midway. Two interesting presentations seen and two more to come. Since this is a full 2-hour session, I will now ask us to have a 5-minute break. So do stand up, do stretch a bit to get your blood flowing, and go and get some water to drink, and be back at exactly top of the hour. So it's just a short break to have a bit of movement, and then we'll continue with Felm at the top of a couple of minutes break. I'll be also going to get some water and come back.
Thanks, Mika. And you don't need to log out participants. You just break and come back to the same session.
So, hello everyone. Now it's top of the hour. And we'll be continuing with a presentation from Felm. So will it be Kimmo?
Okay.
Yes.
Yes, the final, yes, thank you. The final name of this project is now, we have had a lot of changes, but it's use of tablets for education content access by school children. And this happens in Mwanza, and greetings from Mwanza, Tanzania. And about the background, in Tanzania, almost all the children, they have possibility to go to school, but all the school children, they are not in the same level concerning equipment and access to the digital educational sources. And there are very few computers and in those schools which are in the rural area, and sometimes there's even no electricity. So this is the situation, but there are good sources where to get free sources for learning and help those students with their national exams. And our aim for this experiment was to test how the network is working in the rural areas. We don't know if somebody says that it works fine. We didn't know. And then also test how the school children, how they will take the possibility to learn through these digital equipments. And also about the small solar chargers, are they really practical and how they work in this hard-gone conditions. And then numbers, some numbers about the project. We chose only 2 secondary schools. One was in Mwanza and one was in Busamugu. You will see that map later. And we were targeting for 4 students. They had their national exam in the end of November. There's just many reasons why we had to choose this. I'll come back to this later. And they get only like 11 tablets together here, or they are 12, but one was for the admin. And then we made one small questionnaire just to check if they can, how they react and how they learn to use this kind of questionnaire, and about also how they can like state and write what they think about the project. Yes, we got answers from one of the schools, but this is the first school. It was in Mwanza. You can see from the map. It's there are a lot of hearts. This is Mwanza where we live, and this is Mwanza. This is Lake Victoria, and there were these 74 students, and they all participated, and only 5 tablets for the whole group. And for the questionnaire, we got no answers. And the other, it's Ukereve Island. This is also the Lake Victoria. It's 4 hours by ferry there, and there we had 126 students, and they all participated, and they got 6 tablets because they were more. And then this questionnaire, we got 93 of the students, they answered. And this is about the questionnaire because it was just some small things, because it's like a practical use of the tablets. About, yeah, only 4 short questions, and we got like this answer. They were, these male students were 60% and female 40%. And this was surprising that almost 80% they had used computer or tablet before. And then we asked how this experiment helped them, and here we can see these are like very much, and this is much, and this is not at all. So it's something like 70% they thought. No, it's more. 75% thought that this helped them, or helped a lot. Okay, and what was new? For the school children, for some of them, it was the first approach to the digital materials. I think they have used computer or this kind of thing, but if they had to use these sources, I doubt. We should have asked that more clearly, how they have used computers, or what have they been doing with this digital equipments. And then they got possibility and guidance to use the tablets. We had youth workers who were helping them in the schools, and then the solar chargers, they were practical to charge the tablets, but the most important thing was that there was like a torch, and I have got one picture because they had no electricity, and they were studying in the evening in the school, and they used the chargers to give light. And then for this Niakato Bible College, who was like implementing this project, it's some new things, because they are educating workers for the ELCT, Evangelical Lutheran Church of Tanzania, and like theologians in certificate and diploma levels, and then together with Iringa University, and also evangelists and parish workers. So it was a new experiment. It put together all the alumni students from in the field, not all, but some of the alumni actually 2 alumni students from the field, and then this college students team. We chose 3 college students, which they had like a degree in education, and they started this project on the field. And also it brought together teachers and the management in the college and also in the field, and also all church youth workers. And yes, and also yes, this is church-based organization, but the field, it's like there are all the religions, they are together. And then about the challenges we had. Okay. The first target was COVID-19, like training religious leaders and teachers and other community leaders on how to protect themselves from transmission and equip them, and also provide a shared platform for questions and discussions. And also there was one target was the need of using distance learning. But the main target was the COVID-19. But the problem, actually I'll go back. Yes, the government announced we were evacuated this our organization team here, we were evacuated, and then how to get all the equipment, so the tablets and screen cover and whatever. But the prices, we noticed that in Finland they are much cheaper, so we decided to buy them from Finland, but how to get those tablets back here. Yes, this is about the election. Yes, we had the presidential and government election, and the atmosphere was so how to say, sensitive and unsettled. And our alumni, while we started this project, we thought that they could go to those areas together with the tablets, but there are so certain beliefs that it made it impossible. It was not safe to send them with these tablets. So they took some papers, like all the previous examinations. They were printed, and they took some of those prints with them and went first to the field, and then later our college students followed with the tablets. The connection, it's not easy to get like SIM cards even here. One person can have 5 together, and you have to register with your ID, and it seemed so difficult to get 12 SIM cards. So we decided to buy 2 routers, and then we solved this problem. And also, while we were training our college students with these 3 in the picture, we tried to reach those sources of government, but during the election, the whole network was down, so we couldn't like proceed. Yes, but anyway, these dictions, they did good work, and the number of the tablets, it was low. There were together 200 students and these 11 tablets. These technical skills also, if we send somebody to train or help the students on the field, they should be like well trained. And one of our youth workers, he knew how to use computer, but the other one didn't. So that was the explanation, that from one school we got so many answers, from the other not at all. And one thing we have to also be careful is this protocol, how to go to the field, because in the government schools you need to get permission from many different places, and but the local contacts, they helped a lot, like these youth workers. This what we learned, flexibility, we need to be ready to change the plan, cooperation with the locals. About the political situation, we have to be careful. And also rain season. It gave some challenges, this weather. Paper is always paper. We printed all the previous examination, these questions and answers, and made a small booklet for each student because we didn't know how the network would work, and also the number of tablets was so small that now they all got possibility to work. And the results, 200 secondary students got possibility to make preparations for the national exam. And the network seemed to work quite well. You just have to know the right operator, and the local people, they know what is the best one. And solar chargers, they are really practical, and they, yes, in the picture you can see they have put 2 of those chargers there to keep light because there was no electricity in the school. So they could study in the evening also. And the questionnaire, there are, I don't now go more to that questionnaire, what we got, but what we achieved. We are waiting for the results of the national examination if there's any improvement to be seen, but it was so short time. They had time only for 1 week because of all these reasons, this evacuation, and when we could start this project, and also the election and whatever. So they had only 1 week time to use, and they used them every day and also weekends. And then this only short story to highlight, I took the light, it's the solar chargers. They were brilliant, and they were so happy. Okay, and then just some comments from the secondary school students. They were like these 93. These are just few of those. And the principles for the digital development, these were those things that I think our project was like, we got something. And for scaling, they will stay in the Niakato, and we need to upgrade some secondary studies of the college and buy some licenses. And also the alumni, they need some upgrade also. And it's a great tool. And now we got also possibility to improve the network connection in the college in general. So this is the end of my presentation. 15 minutes, 38 seconds.
Excellent. Well timed, Kimmo.
I had to run in the end, but anyway,
yeah.
You gave me 15. Thank you for the 7 seconds.
Yeah, no problem. Great. So now it's time for questions. Also, you can just open the mic and go ahead asking any questions related to this. Ari is already saying that please share the results from the final 4 examinations in these 2 schools once implemented. It would be interesting to know. While there might be questions popping up soon, I'm asking here, using the opportunity, that because this was an experimentation and you had very limited number of tablets there, so what, and then you were complementing those with paper for obvious reasons. So how do you compare those 2? What were the advantages or disadvantages of having those tablets? How was it different then from the pupil point of view or from the learning point of view?
There are
a bit.
Yes, somehow if you have like a video, it will it's easier for the students to follow it's somehow always it's more interesting for them. And of course the level of the how the teachers, how they are teaching different things, it varies a lot. And I think somehow it always in education, if you get the same information from different sources, it helps you. But they were so happy also because of the papers they got, because they have no possibility to get these previous exams to check, because they don't know what it will be, the exam, how it looks like and whatever. But now they could see, so they somehow it's mentally, I think it's good for them. But they almost all of them, they wrote that this was good, but it was too short. They said that why didn't you come earlier? And yes, I think it's the video somehow. It's more interesting, and it's easier to take the teaching from there.
Yeah, good point. I'm wondering if then having, for example, a projector there, and so showing the videos to the whole classroom instead of a smaller group might be something to try out as well. But there was a question from Visa, and maybe Visa, you can open the mic and explain your question, if possible. Visa, if you're online, I think it would be good to hear the question directly from you.
So my question was only that, did you implement that project yourself or by local workers? I mean, church workers, or
Please, could you ask? I missed something. Could you repeat the question?
Was it so that, Visa, that you were asking whether it was Felm that was implementing the project, or it was the local church or school workers who were doing the? Yeah, okay, good, Visa. Yeah, I got
okay. There were, as I told, 3 students, theologian students who had degree in education. They went to, they all went. They had the same name, Dixon. 3 Dixons. They went to the field, and also the alumni, they have studied in the college, and now they are working as youth workers in the field. So I think it's together with the local parish and the college. Well, did I answer the question? I hope.
Yes, okay, thanks. And Peter, you want to continue?
Yeah, thanks, Mika. There's also a question from Ali. And probably before I ask that question, I would want to make a comment that is related to that. That I think one of the other biggest lessons that we have learned from this experimentation by Felm in Tanzania is agility in use of technology. And particularly where Kimo mentioned about the principles for digital development that they focused on, that was a driving force in this experimentation. And what Felm did is that they really understood the community and the problem that was there. They understood the processes, and then they focused on the technology that they want to experiment. And initially, this experimentation was a health experimentation, focusing on COVID messaging at the household level. But then with what happened in Tanzania, they could no longer approach the household level with COVID messaging, where they also wanted to test the level of interest by children in accessing digital curriculum at the household level. So that changed the entire landscape. And because of that understanding and how they did the entire process, they were able to shift to a purely education experimentation. And now they focused on schools other than the household level. So as Ali has asked about the timing, yes, it was a time that there were many changes in Tanzania. And I think if they were to do it now, Felm would probably do it a bit different. They would probably do the experimentation at the household level, which was the initial design, which would actually bring more lessons to test the thirst for digital curriculum by children at the household level, and probably focus on a few schools. So both approaches, they will probably use both approaches. But I've said the biggest lesson is not just about this that they have delivered in schools, but about how to approach projects that are digital-led or ICT4D projects, that before you focus on technology, focus on the problem, the people, and the processes. And that helped them to be sustained when there were many changes in Tanzania and still do an experimentation. Thanks.
Thank you.
Any additions there, Kimmo?
Yes, we thought that we could would have had more time, like for 1 month or even 2 months, to do this experimentation. So then the effect would have been totally different, I'm sure. But this was so short. But I'm sure that it will continue in some level anyway. Education.
Okay, good. And yeah, Peter, go ahead.
There's another question from John Bongay about, did you have to translate the messaging to local languages in Swahili? Maybe Kimmo, you can respond to that. I think this is in relation to when you approached students in schools. Was there a challenge using English? Did you have to translate things?
Yes, so the college students who went to the villages, they speak both English and Swahili. But anyway, the language they use in secondary schools, it's English. So I think the material they were using is in English, the teaching in the videos. Yes, the questionnaire we translated into Swahili to make it like more familiar.
Thank you, Kimmo. I can see Ali has his hand up. It must be very tired. Ali, I give you a minute, just 30 seconds.
Thank you very much. First of all, thank Kimmo of fantastic performance on playing the organs at the Independence Day. But the second issue is that anyway, we've done a similar mistake also previously, where we were operating with the Form 4. And Form 4 classes are very tight on the schedule at the end of the season, end of the term. So especially when taking over to have COVID-19 training for the Form 4 students, I wouldn't do that anymore, because we've done similar mistakes as well previously. It's only concentrating on the education what they have, because that is their final examination, and that's the most important. If they fail, they never get any further education indeed. So considering, I think that next time when you do this and you have more time, so you can probably concentrate maybe Form 3, Form 2, even though they also know English quite well. But I'm sure that it's been a good lesson learned, and I have also learned a lot about your experiences. Thank you very much.
Thank you, Ali. I send back to Mika. Kimmo, thank you very much for your agility. You have done this experimentation in less than 2 months, because a lot of time went into different things that happened in Tanzania.
Yes.
Back to you, Mika.
Okay.
Yeah, quite quick. I can see the need for more time, Kimmo, in this situation. But this is experimentation, and all these challenges, all shortcomings, they are part of the learning as well. And thanks for all the presenters being candid, being open about it. That's in the heart of learning, and that's why we are here. Now, if you want to have a cup of coffee before the final presentation, now go ahead. Let's have like 3-4 minutes So you can refill your cup, do a few steps around the house, and then in 4 minutes we'll continue with Vikes. So a few minute break, stretching, drinking, and then let's have an interesting presentation from Vikes. But now let's have time for Vikes. Is it Markku who is presenting, or you have a team?
No, it's me.
You are all fine.
Yes, I am the team.
Yes, team of one person, no
Yes.
problem. You were in Tanzania recently, were you?
I've been in during this fall. We've been there for 2 times actually,
Okay.
because of the travel restrictions. In spring, we had to speed up a little bit because some of the projects were ending by the end of this year. So, but
Yeah.
luckily we were able to travel.
Great. So you want to share your screen and go ahead with 15 minutes of presentation.
Yes. Okay. Good morning, everyone from Turku, Finland. My name is Markku Liukkonen, and I'm the project coordinator and trainer for Finnish Foundation for Media and Development, working in Tanzania. Our Powerbank project, it's not a examination, or it's more of a study. The original idea was to conduct some experiments with our partner, but because of the situation, the time was not there, and luckily we had an opportunity to do some other experiments earlier this year, which I've been using as an example for also this power bank. So I've been following Tanzanian media field for last 10 years, and with this power bank funds, I was able to dig a little bit deeper and kind of search and prove the current situation of Tanzanian media field, especially community media. How are they using new technologies and online solutions? And as it says that this report presents the current state of community media, how they use different digital solutions, and presenting some existing standards and practices. When we were applying this Powerbank funds, we were cooperating with Until, and they were extremely interested about the case remote learning. But as it was said, Kimo said that in Tanzania, they don't have any corona, and the remote learning issue is not that important there anymore, because all the schools are open and students are receiving education normally. So I took the remote learning issue as a case, how to utilize community radio stations or community media about remote learning, not creating curriculums or this kind of schooling, but how to utilize community radios to disseminate educational content, which is actually at the moment already happening quite a lot. But now I'm interested to see how to use new digital solutions with this. Our main partner is Tanzania Development and Information Organization, TADIO, and it's an interesting organization. It's an umbrella organization for community radio stations in Tanzania, and it has it's reaching over 30 million people, and it has 34 member stations in Tanzania. So it's a quite effective organization, It's been around only for 2 or 3 years at the moment. So this study also reflects the opportunities for Tadio, how to use different tools for their work. So Vikes has been working in Tanzania since 2006, and we started to create this community radio portal in 2015, but it didn't. I cannot say it didn't work that time, but we were lacking of funds at the moment, so we weren't able to develop it in a way that we wanted to. But in 2020, we started the cooperation with UNESCO, and with the assistance of UNESCO, we were able to create the new Radio Tadio portal in cooperation with Tadio and UNESCO. So now this study is presenting different opportunities how to take advantage of this new media ecosystem. Radio Tadio is, at the moment, there is 7 or 8 radio stations, and during 21, hopefully there is going to be over 20 radio stations at that portal, streaming the live stream and also uploading the content, educational content, news and information from their own communities. The challenges are there, as said, with the government, of course. To do this kind of a study or a report, it's quite difficult because there is no accurate statistics, basically about anything, but especially about, for example, the internet usage. As example, to figure it out that how many people are using internet in Tanzania, it varies from 25% to 43% at the moment, depending on the source. And as said, the original concept was to study solely the remote learning using community media in Tanzania, but because there is no corona and the remote learning issue is not important, I'm now reflecting the community media ecosystem in wider scope and presenting new ways to utilize this combination of old and new technologies, how to combine old analog FM radio to new digital mobile solutions. We have this survey or a study made in 2019 by Ipsos, but because of the situation in Tanzania, it was never published, but we had it, and it proves that community radios are basically the most important medias in Tanzania, reaching a lot of people, more people than the mainstream media. And study says that, of course, community radio has the ability to reach marginalized populations anywhere. So the report says that new ecosystems between new and old technologies should be established, and they are at the moment more new ecosystems are coming up. NGOs and private sector and government, they are interested of using community media or community radios in a new way, and this report gives some suggestions that how this should be done. About the case Ifahamu Corona, this was interesting. This happened in last April, when the COVID-19 situation was just a new thing for all of us. In Finland, we created this podcast, Anatomy of Corona, and then I got an idea that this could also work in Kiswahili in Tanzania. So what we did, we did this kind of ad hoc program with Felm, and we produced Ifahamu Corona program about corona, how to prevent it, what is it, only facts and scientific information. For the Kiswahili version, journalists from Tadio, they interviewed Tanzanian experts about the situation, and then we disseminated this program. It was 4-episode program. We disseminated it through the Tadio partner stations, and it eventually reached about 20 million people. It was aired through 32 radio stations. And this is an interesting case because now it's kind of a proof of concept that if we have a educational content that we want to disseminate through the country, it's basically quite easy and cost effective by using community radio stations, especially now with the Tadio, because everything is under one roof and all the information can be shared quite easily. Principles of digital development, these are of course has always been important for Vikes. We are working in a participatory method, the portal. Even from the 2015, we had approximately 10 people from different community radio stations developing it together with us. We are working with many different organizations and civil society, and even with the government. We are planning to scale it from the start. Hopefully this portal is going to be scaled to Uganda during upcoming years. And we are always using open platforms for anyone to use. So we are scaling the portal. This report shows new innovative collaborations, how to work together with different organizations, especially now with the digital educational content that, for example, mentioned at the Powerbank technology solutions. There's a lot of content that could be easily modified to be aired on radio. How to find these collaborations between these kind of digital companies and finding the old school technologies. There's an interesting and yes, converting content to suit different platforms. Many times when especially now 2020, 2021, when you are creating something new, you are thinking about artificial intelligence or what is it, modified reality and so on. But still, radio is I can say that it's the most powerful media to reach wide audience, not only in Tanzania, but especially in Tanzania. So hopefully this report kind of approves the concept that it should be taking seriously this old technology to be utilized with new innovations. That was only 12 minutes, but I think that's my 50 cents for this. Thank you.
Thanks, Markku. It was definitely more than 50 cents. I'll make it much more. Great. So maybe Peter, would you like to go ahead with questions coming up from the audience and also your summary?
Yeah. Thanks, Mika.
Can you switch on the video as well? Thanks.
Trying to fetch the questions. There's a question from Ari about income generating activities in local radio model. Like, do you have any income generating component in the local radio models?
Yes, especially now with Tadio, they have they have a rate card. You are able to buy airtime. You are able to buy time for commercials, jingles. You can even buy a program spot for all the radio stations under Tadio. And the rate card, it's quite cost effective. I just checked the rate card, and what I checked yesterday, with 5,000 euros, you can reach all the radio stations for 2 days with 15-minute program as a campaign, as an example. And the income generated, the Tadio will invoice that from the NGO, the company, or whoever buys the airtime, and then shares the money between the radio stations that air the program. For example, with the Ifahamu Corona, we paid Tadio, and Tadio paid the stations that air the program.
Thank you. There is just a compliment from Kimo about the radios, and I think they have been able to access that in the area that they work and where they were experimenting. But again, there is a question from Mika about if other organizations, for example, member organizations within Tanzania, if they wanted to produce some radio programs and air them, should they contact Vikes? Is this something they can benefit from, that you are working with the umbrella organization for the radio community radios in Tanzania?
We are working with them, but Tadio has really kind of a young and eager staff, and you can contact Tadio. I put the address there, tadio.co.tz, and you can find all the information from there, and just contact the staff if you are interested on sharing your programs in Tanzania.
But apart from contacting these community radios through Tadio, Vikes would also support if they needed some tips and support to work with these radios and to work with Tadio.
Vikes is actually working with the educational side with the journalists, and now developing the portal. And from my point of view, for distributing your programs in Tanzania, Vikes is not needed. You can communicate straight with Tadio. Now, Peter, I cannot hear you.
Yeah, sorry, I was muted. Do you know other umbrella organizations, for example, in neighboring countries like Kenya, like Tadio, where they bring together community radio together to work together? That if member organizations were working in these countries, they can be able to use those umbrella bodies.
Yes. In Uganda, I know that there is a Comnetu, community radio, community media organization of Uganda, and actually Comnetu is the partner organizations that we are starting to work with to scale the upcoming portal, and probably using the learnings that we have from Tanzania. Using the learnings, we are going to scale to Uganda. In Kenya, I'm not sure, it's a bit more different, and for Kenya side, I am not sure.
Thanks. Oh yeah, go ahead. I was just about to ask Peter your thoughts and kind of summary. There's still one question from Nina. Maybe I'll ask it here. Are there any possibilities for misuse in terms of spreading of content? Who chooses what to accept and disseminate? Or is this question misguided?
No, it's not.
It's a good question.
If you are familiar with the situation in Tanzania, the media is, well, you have to be quite careful what you are airing, and all the radio stations are cooperating with the TCRA, Tanzanian Communications Regulations Authority, and they are watching quite strictly that what they are airing. Of course, there is a possibility for misuse, but quite fast there is going to be a sanction for that.
Yeah.
Okay, thanks. Peter, your comments, views, you have been following closely.
Yeah, I think this experimentation by Vikes is an interesting one, and it actually had a big component on research. So it's more of a foundational experimentation for work to be done in future. And I think the most interesting part is that we hope we'll have the report come out soon from Marco, and then we can share with the members, because it creates, the experimentation was more creating a foundation and understanding on how things can be done in future, other than directly experimenting technology. So what comes out of, so Fingo gave the possibility and the platform and some funding for Vikes to be able to do that for future work, which can be scaled with UNTIL and other organizations.
Thanks, Peter, and there are very well-deserved compliments from Noor there in the chat as well. Now we have seen and heard 4 very interesting presentations. So thanks for all the teams very much. And now, if Mika, you are able to, yes, you read my mind. So please click the link, which you can see in the chat. Spend a few minutes. It's anonymous survey, and we are really eager to hear your views on this. Do remember a couple of things to highlight. There will be documentation and reports coming out of these, so more to be published later on. Also, there's going to be a second round of experimentation starting early next year. So then we'll come up with more experimentations, and even if you have received funding for this first round, you can apply for the second round as well, but it will be available for all Fingo's member NGOs. Yeah, Kimmo, thanks so much for stretching. Sorry to hear you are no longer able to work for Felm because of the changes in the structure. We hope we will meet you in other occasions, definitely. So I think this is pretty much it. Do click the feedback link. Peter, over to you. Any thoughts, last words at this point?
Not really, just to thank all the 7 organizations. We have had the 3 sharing their lessons a month ago. We have had the last 4 cohort of 4. And it has been a pleasure working with all these organizations and how agile they are. And we hope to continue working. And we hope to have more lessons as we go to the next round of experimentations early next year, like Mika, you have mentioned. So we hope to see these concepts coming in when we open this up.
Yeah, and Kimmo, do continue following Powerbank and joining us even with the changes in your career. Yeah, all good. So thanks everyone. We can end it here, and actually I think we can wish you very good last days before Christmas for those who are spending Christmas. Hopefully some holidays are soon coming to you after hard work for the past several months.
There's John has raised hand up. John, did you want to say something?
Yeah, I noticed we still have 2 minutes to thank everyone. And sorry, I joined late. My name is John Bonge from Finchurch Aid in Kenya. Particularly to Peter, very sorry that we were not able to have you visit Kakuma at this time. We have some few restrictions that I explained to you, but we will explore that possibility to have you visit Kakuma in the coming year. Thank you. Thank you once again.
One thing, since there are still people online, it just occurred to me that we are going to establish a technology solution library, and that means that we'll have equipment available in Finland and in East Africa that organizations can borrow free of charge and then try it out without investing anything, and then maybe for 1 or 2 weeks, and then see if it works. Maybe some projectors, some media equipment, some other clickers, and we'll be adding up more equipment there. So it's not yet official, but since you were here, just to say it out loud here, that then you can go and get some equipment, test it out, and see whether it works for you. Sometimes just even buying one phone or something can be a bureaucratic hurdle in organizations. So just to trying to lower that threshold.